Welcome back to In Your Prime. If you're living alone, you may have concerns about what would you do if something happened. What if you fell or had a problem and needed some help? If you're caring for an adult who's living alone, perhaps you are an adult child of an elderly person living alone, you need to have that security to know that mom or dad is doing well. And you can do that with an interesting new device that I've just found out about today. It's called the myHalo monitoring system. Chris Otto is one of the co-founders of this interesting new business. And this is what it starts with, right?
That's exactly right.
Yeah, tell me about this system.
Sure. myHalo is the first personal health and alert monitoring system of its kind. Consists of really three components. It's a wearable device like a chest strap that you're holding right there. And if a senior is wearing that at home, they have the confidence to know that not only are we monitoring their vital signs continuously, but we can detect a fall automatically while they're wearing that. They don't need to press a button.
So what kinds of things can you tell from this little monitor?
Sure. If you're wearing that device, we monitor heart rate, skin temperature, heart rate variability. We also measure activities of daily living like sleep and wake patterns, number of steps taken, and most importantly, we detect the falls. Tell
me a little more about this device. This is something you wear strapped around your chest, right?
That's right.
It's really comfortable. It's lightweight.
It's chest strap. Like you said, it's comfortable. In fact, I'm wearing one right now. You can't see it, but it goes about chest level.
And the electrodes are on the back. It doesn't feel like anything. It just feels like fabric.
Exactly.
But the electrodes are built in.
Exactly. It's a conductive fabric, mesh electrodes, so there's no gels, no sticky adhesives. It's very comfortable. That strap can actually be removed from the transmitter module and can be laundered as part of the routine maintenance of the device.
And the button on the front allows the senior to push that if they need to.
Right. Ordinarily, you would not have to press that button to signal for help because we do detect the falls automatically, but if you're wearing that device, even through a shirt or a sweater, you can find that button and press that and signal for help.
All right, so you're assimilating all of this information through this high-tech device. Where is it going?
Right, all that information is collected and aggregated. It goes to a device that's installed in the senior's home when they subscribe to the service and then sent up to our call center. So in the case of the button press or a fall detection, that goes to our call center. So someone will actually pick up the phone, they'll call the senior at home, they'll call the senior's caregivers, their adult children or other family members that are authorized caregivers, and notify them of the event, make sure that mom's okay, and then follow up if necessary with emergency response. The device also, the data, all the vital sign information is available through a web portal so that casual caregivers or a physician can log into the website, check in on the senior, and visualize that information, look at trends over time, and configure the alerts as well.
And that's what the website actually looks like. What are we able to see when we log on?
Sure. When you log on to the website, this is the screen that you'll see when you first log on, and you see a couple things. First, along the right-hand side, you'll see what we call the dashboard, which is an at-a-glance, everything you need to know about mom in a quick snapshot. So, for example, we see the icon that shows that this particular user is in range, everything's working. You see the battery level, current skin temperature. It's important to note that's skin temperature, not body temperature.
Right.
Current heart rate, and then recent events on the bottom. On the left side, you'll see the heart rate on the top. The red line is heart rate, and on the bottom you'll see activity levels. So on the left side of the screen there, you can see this person was moving. They were moving about the house. They were active, and you can see the activity levels were higher and the heart rate was elevated as you'd expect. What you see when the screen flashes every few seconds is it's doing a real-time update. So that's actually live data off someone who's wearing it right now. If you click this recent events button on the right-hand side, what you'll see is a list of events that occurred in chronological order. We color coordinate those for red, yellow, and green for severity. For example, as you see right here, this particular user fell at 11:50 a.m. and that's an event that's not only noted on the website, but as I mentioned earlier, it'll be sent as a text message and email alert, and also to our call center, so someone will actually make the phone call.
Wow. This may sound like an odd question, but how does this device know that someone falls? Is it measuring an impact?
Well,
you have to fall on this, or?
No. That's an excellent question. We use a solid state accelerometer sensor. I don't want to get too technical.
Yeah, okay.
But that's obviously a big part of the technology. It's a sensor similar to what's in your iPhone, for example, that you can move your iPhone and you can see the screen change orientation. It's because we're constantly monitoring motion and orientation. We can tell the relative position of the person, but we're also measuring impact levels and also levels of activity. So we can tell someone's fallen and they're on the ground. We can detect that.
How quick is the response time if there is an emergency or a severe indication?
It's less than 3 minutes. So within 3 minutes of falling with that device, someone will be on the phone calling the senior and the caregivers in their home. Wow,
that's pretty remarkable. How do you work this in terms of a subscription or whatever? Is it a year-long contract?
No, it's a monthly subscription. It's about $89 a month, so about the same price as a typical cell phone service. You can have this device. When you sign up for the service, there's a gateway appliance that will be installed in your home.
How big is it?
It's about the size of a large book. It's pretty small. And really, it's designed to be worn and forgotten about. So the senior wearing that device can go about their normal activities. It's really about independence and about giving them the freedom they need to stay at home longer and enjoy their independence. You can wear it in the shower while you sleep. It's really simple to use.
I would think it would be a feeling of confidence for that senior to know, even though I'm here alone, somebody's knowing what's going on here in this house.
Absolutely. And the seniors that are wearing the device, the ones that we've spoken with, are very positive about the service. They not only like the peace of mind and the comfort knowing that a caregiver is just a few minutes away at most, but also they like the fact that unlike some other devices out there, this device is worn out of sight. So nobody has to know you're wearing it. As I mentioned, I'm wearing one right now.
Sure.
And nobody has to know that you're being monitored. You maintain your independence and maintain your privacy.
Well, and I think privacy is a big issue too. Who actually has access to that website information?
Only whoever the senior authorizes. So typically it would be an adult child, a spouse, or maybe a physician.
Okay, that really interesting technology. How new is it?
Well, we launched product in January at the Consumer Electronics Show.
Brand new.
It's brand new. That's right.
The latest technology right here on In Your Prime. All right, I want to give you a phone number. It's area code 265-489-0094, or you can go on the web to halomonitoring.com. We'll put all that information on our website as well if you'd like to find out more about myhalo.com. Chris, thanks so much. We appreciate it.
Thank you.
Back with more after this.